تقرب منازلها إلا محب زايد أسسها واليوث وراها داروا على الدانات 7 أبد إلا دار زايد لا تقرب حماها لا تقرب منازلها إلا محب زايد أسسها واليوث وراها.
Welcome everyone with your program Bellas of Union with the most successful story in UAE. Today from Dubai City with also a new successful story with Dr. Mahmoud Haqqi. Hello Dr. Mahmoud.
Hello, how are you?
Fine. Doctor, from the first you can introduce yourself.
My name is Mahmoud Haqqi, Dr. Mahmoud Haqqi. My age is 69 years old.
MashaAllah.
And I have been in Dubai since 1986, exactly October 19,
MashaAllah.
October 1986. I have been in Dubai since now.
From the first, Doctor, you can tell me first step here in UAE and why choose UAE for your work and for your life and for your business?
Well, actually, I have been born in Iran. I have been raised in Iran. I have been studying in Shiraz, which has a very famous university from the Shah time. And this university the name was Pahlavi University at that time. Now the name has changed, has become Shiraz University. But at that time that we were in the university, in the medical school, it was almost the same as the universities in USA. So all the students from the Shiraz University, or at that time Pahlavi University, were eligible to go to United States directly without any examination and stay there, or a student from there, they were coming to Shiraz and staying. So we were mixed with that.
Yeah.
I was studying there, and in 1978, I get my MD, and at that time I started for the ophthalmology, eye doctor. The program was 4 years, and at that time, 1982, I graduated from the university as an ophthalmologist. I practiced for 3 years. I served on the compulsory military services, and as I finish, I have been hearing a lot regarding Dubai. So I decided to move to Dubai, and since that time, 1986, I came to Dubai. I find a place to work. And since that time, I've been practicing ophthalmology in Dubai. At the beginning, I was practicing ophthalmology in a private hospital, the only private hospital at that time in Dubai. There was only one private hospital in Dubai, and I was practicing there. But after 3 years that I have been working there, then I decided to establish my own private clinic, and since 1989 I started my own clinic until now.
In 1989 you start your clinic.
1989 I started my clinic.
1989, I think it's before 30 years.
Yeah.
Before 30 years or more?
30 years, yeah.
MashaAllah. You started this clinic in Dubai?
In Dubai.
In same place? Or
no. At the beginning, our clinic was in Baniyas Square, behind the tower. At that time, here it was not much for the clinics, but I started there. Then we shifted in Al Maktoum Road, opposite the municipality. There was a new building. We were shifted our clinic to there. But since 2011, we shifted here, and we have been here in this. From 2011 until now, we are in this center.
Who helped you in this work?
My wife, she is also a specialized nurse in ophthalmology, and she has been practicing ophthalmology nursing with me since the time that we arrived here, and she has been my partner, my inspirator, everything. She is managing the clinic also, and we have been working together since that time.
Okay. Now, Doctor, you can tell me more details about this clinic, and you can tell me service in this clinic.
Yes, actually, in ophthalmology, there are different branches of ophthalmology. That is, some of the doctors are more on the surface of the eye, working on the surface, some on the shabakia, retina, they are working, some on the glaucoma is working. I have been very interested from the beginning of my training in the anterior part of the eye, anterior segment of the eye. So main focus of my job is on the anterior segment of the eye. Let's say the people that they have difficulty in the cataract, in the cornea, problem in the vision, we are doing mostly focusing on that one. Of course, on the people that they have on the shabakia problem, on the retina problem, there also we are doing the job. But the main focus is on the anterior segment of the eye. The services that we have been offering from the beginning has been a trust that the patient has found on us. The first thing that a clinic should do and a doctor should do is to get the trust of the people. If there is a trust with the people, then slowly this will go.
Yeah.
I remember that when I came here, at the beginning, nobody knows us. Nobody.
Oh.
Only there was a only private hospital here, and there was rarely a patient come there for the eye checkup. But slowly, when the people comes and see that you work honestly for them and you do whatever it is needed for them, slowly the people will know about you or about the center or about the clinic, and slowly they will come, and you will have
Now, Doctor, I want to ask you about the future plan. I think every people, every doctors, every clinic have a future plan. You can tell me more details about the future plan for you?
Well, actually, we have been here, we have done so many of the surgeries on the anterior segment of the eye. We have been doing the surgery for the people that they are wearing glasses, what we call it refractive surgery. We have a refractive surgery center here. We are doing the surgery to get rid of the glasses for the people. Our future plan is, if possible, we expand this setting of the refractive surgery, expanding to the maximum, ultimate, and latest technology that are available for the treatment of the eye problem, eye diseases. We have this plan in mind, and we are working on that one. hopefully that we will be able to get very young, energetic colleagues to come and join us, our clinic, to be able to expand as we would like.
Now, Doctor, I want to ask you about the Corona time. What happened in Corona time for this clinic?
Well, at the beginning, because of the instruction of the government to close all the non-emergency procedures, so we obey the rules and regulation of the government. But for the emergency cases, we were open. If there was any emergency, we will attend to that patient. But for the first month that everywhere were shut down, we were only emergency. But gradually, when they let us to open the clinic, we opened the clinic. Of course, we were doing our utmost effort to do whatever it is necessary and to obey all the protocols of the COVID in the clinic. We were sterilizing the clinic every day. Every day, people were coming to sterilize in the clinic on the evening time when we were closing. But we were limiting our office hours for the period of the COVID, that tried not to be in a position that we can make the condition worse. So we were limiting our office hours, but fortunately we have been able to manage that one. Now the clinics is running as usual. As usual, the patients are coming here, but definitely we are doing our best to avoid anything to do to spread the COVID, and we are doing our utmost effort.
Now, from your side, Doctor, we want to send motivation message for the young people. We want to enter the doctor world and send motivation message for our young people. We want to enter the business world, businessman world.
Well, what I would suggest to the young doctors, young ophthalmologists, that first of all, they have to consider the patient as a part of their family. Whatever they do for their family, they have to do it for the same. So when a patient coming to me, I have to consider that as my brother, my sister, my father, my brother. So this is the first thing. The second thing, the honesty. Honesty is the most important thing for a career of a doctor. If you be honest, definitely people will know you and they will not forget you. Let me tell you, one of our professors, when we were in the college, was telling us that for a doctor to work, if he is honest, for all his life, he will have his support of the patients. If there is a doctor or anybody, anything, you can cheat a small group of the people for a long period of time. And you can cheat a large group of people for a short period of time. You cannot, if you do not have a trust, people don't have trust on you, you cannot survive. This is the essence of the practice. Honesty is the only thing that, this is the first thing. The second thing is that you consider all the patients that are seen by you as your family. Whatever you do for your family, you have to do for the patient. If you consider these two parameters, then this is the key for the success. The key for the success. Yeah.
Okay, now from your side, Doctor, send a thankful message for all leaders and Sheikh here in UAE and the people support you here in UAE.
It has been a pleasure for me to be in this country with the help and assistance of the all government officials and the sheikhs in all UAE, especially His Highness Sheikh Khalifa and His Highness Sheikh Mohammed bin Rashid. Thank you very much that created such an environment in UAE that led us to be here for so many long years, having been in a very safe country, and there is a situation for everyone that he wants to be here and to live in a safe country, and we have been really happy to live here. We do not want to live here because whenever I go for 1 week, 2 weeks out of the country, again, I am counting day by day to come back to this country as a feeling that this is my home country and stay here. Thank you very much.
Thank you so much, Dr. Mahmoud. Nice to meet you.
Thank you, sir.
Thank you.
Thank you.
See you next week with also a new successful story in our program, Bellas of Union. Goodbye.